Hello, recently you've been scheduled for carpal tunnel and cubital tunnel release, and I made this video to give you a little more information about your surgery. Once you've been approved by your insurance, my schedule will make arrangements for you to see your primary care physician for a preoperative history and physical examination. At the day of the surgery, you're going to be seeing my anesthesiology team, and they will perform a regional block to your extremity. They will give you a numbing medication to your arm. Your entire extremity is going to go to sleep. To do the carpal tunnel and the cubital tunnel release, we use a tourniquet so there's no bleeding during the surgery. We make an incision for the carpal tunnel right around here, around your palm. It's a very small incision. And as well, we'll make an incision to your elbow. In regards to the cubital tunnel, there are two options that can happen to you during the surgery. After I perform the release around the elbow, extending down to your forearm and up to your arm, I will move your elbow up and down and see how does your nerve behave. If your nerve stays inside of the groove, there is no need to do a transposition. However, if every time when I bend the elbow, the nerve goes up, when I extend and the nerve goes down, that means that this nerve is unstable. And I have to do something to help so you don't have chronic numbness and discomfort to that nerve. So I need to do the anterior transposition, which means that I'll put a small fascial sling and I'll keep the nerve transposed to the anterior portion. So what it means for you postoperatively is, if you have an anterior transposition, you will be having a long arm splint that you're going to have to wear it for 2 weeks. You're not going to be able to take it out. You're not going to be able to get it wet. So I only were going to remove that when you come to my office. On the other hand, if I do not need to do this transposition, you're only going to have a soft dressing to the elbow and to the hand. And 2 days after surgery, you can remove all the dressings and start moving both wrist and elbow. And for both surgeries, I will see you back in 2 weeks. I'll look at your incision, make sure things are healing, and hopefully at that time, you're going to start feeling some improvement for your symptoms. Then I'll see you back when you're about 6 weeks out. So, I hope the surgery could give you some information about the surgery. Of course, if you have any questions, always contact our office. Thank you very much that you chose me as your surgeon, and I'm looking forward to seeing you at the day of your surgery.